Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. Hi, Julie.
Yeah, hi, how are you doing?
I'm doing okay. A lot of people out this weekend. We'll get to that in a second. Explain to me what the head of the coronavirus task force means. That's, of course, Vice President Mike Pence, when he says the reason for the increase in cases is because the increase in testing. Doesn't the increase mean the virus is still spreading the same? We're just detecting it more?
Well, yes, I mean these numbers are always so confusing. Um, part of it, of course, is that you're not going to find the test, you're not going to find the cases unless you test for them. Very few places in the country are still doing adequate testing. I'm happy to say that in Champaign County we are, but that's because of a confluence of events like the U of I and Carl and us having a community-based testing site and CUPHD having a ton of contact tracers. So we're in a little bit different position here than the rest of the country. But another thing so it's not all attributed just to more testing. There is an increase in the test positivity rate. That means that there are more people testing positive in those that are testing. So that number is a little easier to make sense of than just saying, an overall number everywhere. So that it absolutely, the numbers of cases are increasing across the country, not everywhere and not at the same time. And that's how it's going to be throughout. But definitely if you look to places like Florida and Texas and Arizona and other places too, Utah, I think right now is still up there. There are really high numbers associated with basically reopening things too quickly. I mean, the White House task force opening plan said, you're not to have that unless you have 14 consecutive days. You're not to open 14 consecutive days with downturn, and that was just ignored. And we're seeing the results of that. We're also seeing the results of just in general other places opening up. Even in Illinois, where we were in that zone to be able to open up, we're seeing increases as well.
You mentioned in Champaign County, we've done a good job of testing and we've been able to move into phase 4. What would it take numbers wise to move backwards with certain consecutive days, or what would that look like?
Well, it would be a increase in, a massive increase in the numbers of indicators like the number of cases, hospitalizations related to cases, and things like that. It's not just one thing, but we are definitely seeing increasing cases that are caused by events that are preventable. So, in the early on, most all of our outbreaks were associated with the workplace, basically essential workers who were being infected, on their jobs or bringing it to their jobs, and that it was spreading around. Now what we're seeing is an increase in outbreaks that are totally preventable. This is from, parties, from bars, from places like that. And it's, the bars are going to be a problem. It's a problem all over the United States. And it's one that is not, I don't even know how you would go into a bar and comply and do it as safely as you would need to. That would require masks on everyone, and I'm 100% sure that's not happening.
Well, Texas has now gone backwards and closed bars. It's a little late, but daycares in Texas, they have 1,300 cases now. And in Florida, we just this weekend saw an 11-year-old die of COVID. We're seeing younger people get this. Is this a new trend, or are we just sort of trying to figure it out as we go along, what's happening and why are more young people getting it?
Well, I don't actually think it's a new trend. Again, it's sort of like, where was it originally spreading? And it was mostly spreading through, workplaces. As we start seeing more parties and more, bars and people going back. So what happens is you get infected wherever you're infected. Let's say you're infected at, a party or a bar. You go back to your homes. The people in your household, this is so infectious. Most people in the households do get infected with this, and then they go to their jobs, and all this is being done without anyone. It's before they start exhibiting symptoms, so they don't even know, and it's causing additional outbreaks. So yeah, and as it goes further and further and, more into homes and things, we are going to see more kids. We're seeing more kids locally. And we have, since the beginning of this, we've seen, everything from infants to the elderly die. Obviously, the elderly are dying at in higher numbers, but it is not. It's just one of those things where I don't understand the sort of cavalier attitude toward this, because every time that there's a new infection, you're basically rolling the dice. Because are you going to be one who just gets over this with minor symptoms, or are you going to be someone who progresses to, this weekend you just saw the Broadway star Nick Cordova die. He had a horrible case. And there are a lot of people like him that just because they are not dead, that doesn't mean that they're okay. So we've seen everything from amputations to the 20-year-old in Chicago that needed the double lung transplants, to people that are having just, months-long illnesses from this. It is, and we really, because it's so new, we really don't know what are going to be the long-term effects from this. I hate to always keep doing this, but I always have to go back to the beginning of HIV. It was the same sort of thing. At first, it was just, we were concerned about like the opportunistic infections and things like that. And then you find out that, oh, wait, this is, there's a lot more people, and we don't know what the long-term causes are this. There are a ton of people that you can't see with the infection, and what's going to happen, farther down the line. And because this virus is so new, I just don't understand why people can't do the simple public health measures to protect themselves and others from risking that. I mean, nobody wants to be the one who passes on the virus to somebody who has a horrible outcome or dies. Nobody wants to do that.
And you talk about recovered a lot, and in the numbers that are reported, it's people recovered. That may mean that they're now asymptomatic, they're fever-free, they're no longer contagious, but people have lingering effects for months, correct?
Yeah, right. And recovered is one of those words that, you use in public health or in medicine and different places. It's used kind of differently than what people might think of. For us, our numbers that say recovered, all that means is that you are no longer infectious, or you're no longer in isolation. Therefore, you're no longer in isolation because you're not infectious. That does not mean, and we have had people who have been sick for months with this, fevers, debilitating pain, inability to do anything because of shortness of breath. These are not always mild cases. I mean, certainly people do have it, but we've had young people with very, very serious cases and hospitalizations. And all over the country, you can look and see everything, again, from infants on up, who get severe cases and or die from this. So it is literally just rolling the dice. And I don't understand why anyone would risk that.
Well, a perfect dovetail into my next research. There are 4 types of face masks commonly used by the public. There's the stretch mask that has 2 layers of fabric, the commercial cone mask, a folded handkerchief, and a bandana. And they stitched masks with 2 layers of fabric performed the best. So that first one did. The cone style was second, a handkerchief was worse, and then the bandana gave you the least amount of coverage. But would you say if you can cover your nose and mouth with anything, it's better than nothing?
Yes, absolutely. Put on, I don't care if it is a commercially purchased mask, one you make yourself, a double layer of a bandana. Again, double it up, which I think you would do anyway, just to get it on there. But at the beginning, there was a real shortage of masks. That's not an issue now. Any face covering is going to help. And there are numerous videos available if somebody just wants to look at them online. There's all kinds of videos showing how much breath comes out when you are wearing your mask and when you're not wearing your mask. And you can also look to other countries like South Korea and Taiwan. A lot of the Asian countries have a culture because they've had other respiratory illnesses, and they know that at the first sign of that, everybody universally masks. It's not considered a political thing, which it is not. There is nothing political about a mask. That's just ridiculous. It is a public health intervention, and one that is just about all we have. That and maintaining social distancing. That is all we have to protect one another during this time until we get a vaccine or a prophylaxis or a really effective treatment. So people really need to consider doing this, because we're moving into a whole different stage now where you're going to start seeing a lot different transmission of this virus, because people are going to be around each other more. They're going to be inside more. Like I said, I am not comfortable with bars, for example. Those are just like almost the number one thing for a variety of reasons, including compliance, lack of compliance, I should say, including talking loudly, including grouping up in little groups and talking loudly amongst each other. And you're in there for a long time, and you're with groups for a longer period of time. So it's a complicated matrix to figure out what is safer and what is not safer, but anything is going to be safer as long as there is a mask and social distancing. And if you cannot do that, then it is not safe. It doesn't matter what you're doing.
You may have just answered this with the bar answer you just gave, but why are cases increasing but deaths are decreasing? Is it because that crucial millennial healthier age are getting it but not dying as often?
Well, yeah, I mean, there's a lot of reasons for that, but as you have to be careful a little bit with the numbers, because so if people are getting access to testing early, and meaning that they can test before they have symptoms, there's usually a lag between if they are going to test and then when they are sick enough that they would need to be hospitalized, for example. There's usually at least a week lag time there, and then the deaths are what's called a lagging indicator, and those can be, several weeks to a month or more behind. So you have to be careful with that. And what you need to look at are what is actually happening in the states where we're seeing this increase. It's the same thing that we saw in Chicago, same thing we saw in New York. We're now seeing this in other states. And it's unfortunate, it's whoever is the first, the first place to go, if you will, they often have a rougher time of it because they're trying to figure things out and they're really behind the eight ball. Once you're moving along, we know the things that work. And when we're not seeing them implemented and we're seeing just this almost insane rise in cases in these places, it just doesn't make any sense. There's no need for it. But I guarantee you're going to start seeing more deaths associated with that. As more people get infected, the likelihood of more deaths increases right along with it. It's not an exact number, and there's so many things that go into that, but you're definitely going to see more mortality and morbidity when you have more cases.
Why didn't we see an uptick in cases from all of the marches 3 weeks ago for Black Lives Matter and that big weekend? Why didn't we see an increase in cases?
Well, it would appear because of two things, really. Number one would be mask wearing. If you look, you see lots and lots and lots of mask wearing, well over 80%, it would appear. So that's number one. And number two is the nature of what they're doing is marching or moving. And even if they are closer together than they should be, you're outside, the air's moving, and you're moving. You're not standing together in clumps, talking without masks on. If that were happening, that would definitely cause outbreaks. So it's a combination of many things, and it's no different if you weren't protesting, but you were all outside and you were doing whatever. Even if you were a big group and you were all wearing masks and you were all moving, it would be the same type of thing. You would expect to see less. Anything that involves being inside is going to increase risk. Anything that involves remaining in one place for a longer period of time increases risk. Anything that involves talking or singing or doing anything loudly, that increases risk. Panting, like that would be me in the gym, for example, that would be dangerous because I would be panting out, anything like that where you're expelling more air further and where you're not wearing a mask. It's just not safe.
You just described school, whether elementary, middle, or high school, that you have to wear a mask if you're going to be close together. Do you expect schools to implement that policy when kids go back to school in the fall, that they have to wear a mask all day?
They would, but even with that, they would need to do that and remain further away from each other and cohort. And I mean, there's just so much that goes into that, it's really something that's still being looked at. I'm not comfortable saying that going back to school is going to be safe for everyone. I'm not comfortable with that at all. It may be that districts are going to have to look at hybrid type of models where, you know, some kids can come back to school, some teachers may come back to school, others may work online. I don't know, but it's something where you have a lot of the issues coming together in one place, and that makes it less safe.
I know you get individual questions a lot. Can I go to a barbecue if we're outside and we don't get near each other? Well, can I go to church? We're going to stagger pews. My friends and I want to go to the pool. I promise that we'll be outside and separate. When people ask you these individual questions, can I fill in the blank? How do you answer them?
Well, I try to answer them. I try to answer every one I get. But in general, it is a matter of looking at all the different components that go into like a risk model, if you will. So are you outside? Are you moving? Can you remain away from people? Can you wear a mask? What are the choke points or the clogging points? You know, can you avoid those? And I always tell people, even if you're doing something that's allowed, if you get there and it's not being done correctly and you see a crowd or you see a group and you can't stay out of that group for other than just a couple minutes, don't do it. Don't go into it. Because ultimately it's up to each individual's behavior. And, you know, watching the news this weekend to me was horrifying. I saw people just crowded together in all kinds of places, and there will absolutely be outbreaks associated with that. So, you know, I do try to answer questions when I get them, but mostly it's all, my answers are always going to be the same. Outside is safer than inside. You have to maintain social distancing from anyone who's not in your cohort, so basically your household, or you can have others in your little cohort as long as they're all playing by the same rules. You know, wearing the mask is essential. We wear masks here at Public Health every single time. You know, we're not sitting right in front of our own computer. You just have to.
And the masks, there are misconceptions about them. I have asthma. I'm not sucking in too much carbon dioxide. I wear them when I go inside. So I see a lot of people out there using that excuse that they can't wear one because of medical reasons. It's uncomfortable for a lot of us who do have medical reasons, but do you think more people could probably mask up and we would be better?
Yeah, I mean, basically it's this. So I also have asthma, and for example, I think I've said before that when I was fit tested and did the thing with the spirometer, I was not able to exchange enough air to do so, you know, safely through a respirator, which is an N95. We'll just ignore that little cart going down the hall during forgot to shut my door. But yeah, I mean, so the thing about getting too much carbon dioxide, that is just not a thing in these cloth masks. You can't have it both ways. People who argue that they can't breathe in the mask are the same ones who say, well, I'm not wearing the mask because they don't do any good anyway. So either it's keeping too much air in or it's letting too much air out. Which is it? You know, it can't be both. But the fact is, cloth masks are, and they may be uncomfortable, especially for people with glasses. They're very annoying. I have to deal with that too. But but they are serving the purpose. They're keeping and again, watch a video online about this. There are plenty of them that show that it's keeping it in. It's keeping your breath a lot closer to you and not extending out the plume. So if you are if you are infected and you don't realize it yet, it's protecting other people, and that's very important. It also keeps the viral load, you know, down in the room. If there's a bunch of people in a room, even if they are remaining 6 feet apart, all that breath is still going in the room and it's hanging in the room. So keep the masks on, even though they're uncomfortable.
On that note, I want to thank Jason Liggett, who apparently never stops working for UPTV, whether or not he's in a car. Thank you for producing today, as well as Urbana's Mayor, Diane Marlin. She's always working as well. Thank you for letting us continue to do these. This is our 19th one. Julie Pryde, I know. Thank you for continuing to do these with me. You're the administrator of the Champaign-Urbana Public Health District. You've been our voice through all of this. Thank you for continuing to do that.